I'm with Dr. Zach Rosenthal, who is an associate professor of psychiatry, behavioral sciences, and psychology at Duke University, United States. Zach, thank you very much for joining me. And I understand that you will be presenting at the 6th International Conference on Hyperacusis and Misophonia at Birkbeck College, London, 1st of July, your presentation is.
Yes.
And so tell us a little bit about what is it that you will be talking about.
Well, first, I'm delighted to be able to be there in person. I'm excited to come and excited to share this research. The question we're asking with this research study really has to do with understanding what are the psychological and medical correlates of misophonia. And a number of people have asked that question, and there's a lot of preliminary research on this. What we set out to do with my team at Duke is to use gold standard diagnostic structured psychiatric interviews using what's called the SCID-5, which really is just an interview that measures DSM-IV psychiatric interviews. So we're going to be presenting data from a group of several hundred adults with misophonia. And in all of them, we have DSM-5 related psychiatric diagnoses. So this will be the first that we're aware of study that assesses DSM-5 psychiatric disorders in a large sample of adults. And it's a comprehensive assessment. This is not self-report of a couple of different select disorders. This is really the full, very, very long diagnostic interview. And then we also assess medical history. And so we've got a long list of medical history questions that we ask people with misophonia whether they've experienced for themselves or their family. So this is a presentation of that data. We'll be able to share really what are the DSM-5 psychiatric disorders and what are the medical history correlates that are associated with severity of misophonia symptoms.
That's very interesting, because there are lots of studies that have looked into comorbidities with misophonia, but there's not proper general looking at everything, if you like, in medical assessment and psychological evaluations. And there are often these symptoms of anxiety and depression would be present, but it's not clear, is it proper anxiety or depression, or this person just got depressed because of their symptoms of misophonia, and also medical conditions, Tourette syndrome, autistic spectrum disorder. Are there really something in it relevant to misophonia? And almost
exactly right.
Yeah,
exactly right. If you're in the world of misophonia, you know that there's very little good scientific information to specifically tell us what misophonia is related to and not related to. In terms of medical history and psychiatric diagnoses. There's lots of good preliminary data, but to your point just now, there really aren't any large studies using DSM-5 psychiatric disorders in a comprehensive way. And so we don't know, and there's really not any large studies that have looked at a comprehensive list of medical history correlates. So this won't be the definitive study that defines everything either. This will only be one study, but it is one large study, and we spent a couple of years doing this, and we're excited to share the results. We think it'll be new and interesting data for the field to think about.
Yes, and I look forward myself to listen to your result and learn from it. And there are many other people who are doing research on misophonia. Some of them are working on interventions, earlier stages, but I'm sure that they can be influenced by your findings, and it would be great to have discussions there. And you've been working on misophonia for a long time now. I understand that you have the Duke Misophonia questionnaire for assessing misophonia, and also you have international collaborations with other researchers around the world.
Yeah, we have at Duke what's called the Duke Center for Misophonia and Emotion Regulation. And in the center, we primarily do research, but we also do education for the lay public and for clinicians. And then we have a clinical arm of the center that does clinical services at Duke within the medical center for people with misophonia. So it's really a research, education, and clinical center, but primary focus is research. And we have spent the last 4 years actively doing a lot of different studies. We've developed the Duke Misophonia questionnaire, which is one of, there's a small handful of self-report measures that
It's growing apparently.
there's a growing number, there's a small number that are really pretty well developed psychometrically speaking. And we think this is one of them. We also developed recently and published just recently the Duke Misophonia interview, which is the first published paper with a semi-structured clinical and research assessment tool for misophonia severity. So we have the DMQ and the DMI, and then this study that I'll be presenting at the conference looks at kind of the question of what is the phenotype of misophonia. And we have a number of other studies, including some treatment studies that we're doing. So yes, we're active doing a lot of different things. It's been a lot of fun, and we're looking forward to presenting these data.
And then the semi-structure interview, is that what Rachel, your PhD student, will be?
Yes, yeah, Rachel Guetta developed this, the Duke Misophonia interview. And as I said, this just was published in Personality and Individual Differences several months ago. So it's recently out there. It's a fantastic tool, and its structure is modeled after the CAPS, which is the Structured Diagnostic Assessment for PTSD. That's not to say we believe that misophonia is directly related to PTSD. It's just to say that we use that as a kind of structured tool to kind of guide how we asked questions and what the structure of the questions would look like. So if you're familiar with that diagnostic tool, which many people are, then this will be very, very easy to adjust to.
And to use in clinics. And it's on the second day of the conference, there are it's an assessment session, which there are lots of PhD students actually presenting their results about different questionnaires in different languages for misophonia and hyperacusis. So the sessions go hand in hand, the mixture of hyperacusis and misophonia, given the similarities between the conditions. And one can learn from the other one. So specifically in the assessments of them and also mechanism, all of those. So it's very interesting to see a lot of PhD students working on questionnaires, and each questionnaire is looking at the problem from a slightly different angle.
That's right. That's right.
Very interesting.
Yeah, that's exactly right. It's as you know better than I, it's very difficult to assess and differentiate hyperacusis from misophonia using self-report measures only. It's very, very hard to be able to do that. But it is something that needs to be better studied and better understood, because it's very clear that depending on how you assess hyperacusis, that might influence whether your findings in a study tell you that your misophonia severity is or is not related to hyperacusis. If you use a self-report measure of hyperacusis, such as the Hyperacusis questionnaire, odds are, at least in our studies and in my experience, that you're going to see a correlation between misophonia symptom severity on pretty much any misophonia measure that's reasonably well validated and hyperacusis. But if you use more objective measures of auditory functioning, and then you compare them to self-report measures of misophonia, as you know, the literature is much more mixed on what you will find there.
And the interview, I think the interviews as you're working on them are critical, because it's much more definitive when you use those structured interviews to get to the bottom of the problem, whether it is hyperacusis, misophonia, or general noise sensitivity. That's also play another
That's right. That's right.
problem into the mix.
That's exactly right. Yeah, I mean, there's really not enough good tools to assess and differentiate all of these related but somewhat different intolerance conditions. But we have to proceed with what we have. So, you know, science is a million billion puzzle pieces, and we have to keep going, keep iterating. And this tool that we've developed, the Duke Misophonia interview, it does have a piece of it where we tried our best to differentiate from hyperacusis. But you know, ultimately, the science will tell us whether that measure is doing its job in differentiating misophonia from hyperacusis, or whether other questions or other measures need to do it better. What's really exciting to me, quite honestly, is just that the pace of the science is picking up in this world. People from all over the world, there's new researchers from various places that are actively getting involved in these questions that you and I are talking about. And that's exciting because we're seeing that the pace and the volume really of research on misophonia is picking up. That's what we need. That's what we need.
I think that's the main reason for it, is because it is a real problem. And when somebody starts working on it, it resonates with patients who are experiencing it and the clinicians who have been encountering this and didn't know really what to do. So therefore there is that reality there, exists. So it's kind of feed into the interest of curious people and helping them to start doing more studies on this.
Yeah, I agree. And I think the piece I would add to that to me is really the most exciting part of it all, is that for research to happen, it costs a lot of money, right? Like it's not free to do this. And the pace and the volume of research picking up tells me that there's more and more money being invested, that more and more people are choosing to use their time, use their funding to ask these kinds of questions. It's one thing to see something clinically and resonate with it. It's another thing to decide to use your research funding and your time to go study it. And people are choosing to do that, and that tells me that we're kind of moving in the right direction to start answering some of the questions that those of us who are clinicians, and certainly those of us who have misophonia or know people in our lives who have misophonia, we have lots of questions that are unanswered. There's so many questions that are unanswered, but now the research is just beginning to start to move in the direction of beginning to answer those questions.
Exactly. And there are some problems, some disorders, some diseases, some conditions that are extremely difficult and unlikely to work it out what it is. And it's going to take ages for us to realize. But I have a different feeling about misophonia. I don't think that this is going to be a very difficult thing to basically understand, and at the end of the day help people who are struggling with this not to struggle. And I think that is something that can happen in near future, and it makes sense. There's something that can be solved and help a lot of people. Apparently there are many people who at least have some level of this condition. So the sooner it is done, the better.
Well, I hope you are right. I really hope you are right. That's a very optimistic and positive outlook, and I really hope you're right about that.
So we leave it at this positive note.
Yes.
And so I look forward to meet you in person in London on 1st of July. And so thank you very much for your time.
My pleasure, and I can't wait to meet you and to see everyone there.
Thank you.